Welcome everybody to this wonderful launch of what is an amazing report looking at psychological distress in young people in Australia, a partnership between Mission Australia, Black Dog Institute and Microsoft here this morning in welcoming people here for this launch. By way of background, my name's Jono Nicholas. I'm the founder and managing director of the Wellbeing Outfit and also the Chief Mental Health Advisor to EY Oceania. Before that, I had a wonderful life of public service in leading Reach Out Australia for many years. And it's really my great honour to welcome everybody here to this launch. Just as we kick off, a little bit of housekeeping. Want to introduce our wonderful panel. We have Professor Jennie Hudson, who's the Director of Research from Black Dog, who will join us shortly. Stephen Worrall, who is the Managing Director of Microsoft Australia, James Toomey, who you'll hear from in a second, who is the CEO of Mission Australia, and Nathan Gunn, who is an amazing youth advocate from Victoria. So what the process will be today is that James will share some of the opening thoughts, take you through some of the highlights of the report. We'll have then an opportunity to come back to the panel. Once again, I just really encourage you to put up questions and answers, questions in that section, in the Q&A section, and we will seek to bring as many people into this conversation as we can over the next hour. So without further ado, I would like to welcome CEO of Mission Australia, James Toomey.
And morning, Jono, and morning, everybody. It's great to be with you here this morning. And I acknowledge that I'm on Guringai land. We're all on different country, as we know at the moment. I just lost my place. So I'd like to tell you a little bit about Mission Australia to start. We're a non-denominational Christian charity with more than 160 years of experience of meeting human need across the country. We deliver more than 480 youth, community and aged care services. And we strive for an Australia where everyone, all of us, can have a safe home and can thrive. This vision includes a strong emphasis on advocating for and serving young people. We do this both through our practice in support of young people, as well as a research programme that aims to better understand the circumstances and issues facing young people in Australia. Our youth research programme is underpinned by our youth survey, our annual youth survey. And our survey is now 20 years old, and it remains the largest survey of its type in Australia. The age range for the survey is 15 to 19 years, and this represents a significant period of adolescence, the usually stressful later years of school, as well as the transition for young people from school into further education, training and employment. Mission Australia's Youth Survey is a critical piece of research used by our organisation and sector colleagues, like the Black Dog Institute, to influence governments, policymakers and community organisations. And despite launching and collecting young people's responses during the first episode, if you like, of COVID in 2020, we were really pleased that we heard from 25,800 young people. And yesterday we launched our 5th biennial joint report with the Black Dog Institute, which looked at how young people's experiences of psychological distress changed between 2012 and 2020. More than 1 in 4 young people aged between 15 and 19 identified that they were experiencing mental health challenges in 2020. This is a significant increase since 2012, when 1 in 5 young people were facing similar concerns. It also showed us that young people had higher odds of experiencing psychological distress if they identified as female, non-binary, living with a disability, or Aboriginal and Torres Strait Islander. It looks at young people's help-seeking behaviours, pointing to the vital role that parents, services, friends, schools, and the internet and apps play as the sources of support for young people who are experiencing psychological distress. Feeling scared or anxious to get help, feeling embarrassed, and or feeling I can deal with it myself were the three most commonly cited barriers that young people reported as preventing them from getting the help that they need. The top issue of concern for those experiencing psychological stress were coping with stress, mental health, and body image. There was also a notably high level of concern about other levels, including school or study, family conflict, bullying and emotional abuse, physical health, personal safety, and suicide. More than 5 times the proportion of young people with psychological distress reported concerns about suicide than their peers who were not facing mental health concerns. We found that young people with psychological distress were twice as likely to report being unfairly treated in the past year compared to respondents without psychological distress, with the top reasons for unfair treatment being gender, mental health, and sexuality. Young people facing mental health concerns were also almost 3 times as likely to get 6 hours or less of sleep per night, and 2 times as likely to report they were doing no exercise. As I'm sure you'll agree, it is deeply concerning that so many young people are facing mental health challenges in Australia, particularly as they tackle the COVID-19 pandemic and all the concerns that come with lockdowns and restrictions. Youth mental health remains a serious national challenge that we believe must be tackled as a priority. Irrespective of their location, background, or gender, young people must have the resources they need to manage their individual mental health journey with access to youth-friendly and evidence-based mental health supports. Mission Australia and Black Dog Institute are calling for more action from governments, schools, families, businesses, and others to prioritise this. So together we can reduce the prevalence of mental ill health among young people in Australia. Some of the key recommendations we have put forward are: we want to see standardised national mental health screening put in place for schools so that there is a universal system set up for identifying and responding to young people's mental health concerns. In addition to this, there needs to be the development of national regulatory guidelines for evidence-based mental health and wellbeing programs in schools to ensure that students receive interventions that are proven to be effective and work. We know from the findings in this report that parents and peers are vital sources of support to our young people, which is why there is a need for more funding for research into evidence-based solutions so that they, parents and friends, are equipped with the skills and knowledge to provide effective support when needed. Better supports and further investment is needed to establish coordinated mental health infrastructure so that service provision is matched to youth mental health demand. With the internet and apps being more important sources of support for young people who are experiencing psychological distress, we call for more investment in evidence-based digital mental health services to increase their reach and accessibility for young people. There's also strong confirmation in the youth survey data that gender-sensitive mental health services are important to responding to the concerns, challenges, and support preferences that of young females. That's why we want to see more funding of research to better understand the increase in psychological distress in young women, so that we can use this to develop and implement programs and supports tailored to the needs of young women. It's also very clear that we need more culturally safe services for Aboriginal and Torres Strait Islander young people to address the overrepresentation of these young people experiencing psychological distress. And we call for more tailored services for non-binary young people and the broader LGBTQI+ youth community, who should also be funded as a priority. As well, something we think is especially important for young people's voices is to be central to the co-design of programs for young people. They are, after all, the experts in what an engaging, appealing, destigmatizing program or service looks like. Programs designed for young people are much likely to succeed if young people have been involved in the planning, development, and delivery of them. COVID-19 and its broad social and economic effects presented many new challenges and stresses for young people, including impacts on their education, healthcare, and employment. Other research has consistently shown that psychological distress appears to be heightened compared to pre-pandemic levels. More than ever, all levels of governments should act to protect the mental health of young people during the pandemic and in the transition to a post-pandemic world, and give young people in Australia every chance to thrive and live a fulfilling life. I would like to note that through the Youth Survey and other work done by Mission Australia and the Black Dog Institute, we constantly hear the stories of young people who have shown great resilience, optimism, and insight, which gives us tremendous hope for the future. But we can also see that young people are asking for change when it comes to their mental health. We all have a duty to safeguard young people's well-being and properly support the enormous number of young people contending with mental health challenges. Every young person in Australia should have access to appropriate support at the time they need it, most definitely under special circumstances like a global pandemic. I'd like to thank you all so much for your interest in supporting the mental health of Australia's young people, and for your interest in the findings and recommendations of this report. And I would particularly like to thank Black Dog Institute, who have worked with us on this report, and Microsoft, who have been incredible supporters for us consistently. Stephen is with us and is a big, we're a big fan of Stephen and Microsoft, and I think he is of us. And I know that we would have been, in an ideal world, actually at Microsoft this morning doing this launch. So we're very pleased to have that opportunity. But this is a substitute. Thank you, Stephen, and thank you, Black Dog, as well.
Thank you, James, for that wonderful overview of the report. We're going to move into the conversation part of the launch now. As I said, we've got a wonderful panel of different perspectives. James, obviously leading one of the most critical life services organisations in the country that serves the whole community. We have Jennie here who really can kind of, I think, drive some insights into what does this research mean, what do we understand, and then really bookending it with two experts. Firstly, Nathan, you have the very challenging job of representing your generation in your perspective. And Stephen, as was shared before, we need more advocates like yourself from the business community leading a broader conversation. And we very much thank you for the work that you've been doing, not only at Microsoft, but I know also in being the founding chairman of the Corporate Mental Health Alliance here in Australia. I would also encourage, just as people are coming through, please ask questions in the question and answer box. I will do my best to fold those in either towards the end or during the conversation. And maybe, James, if I just start with you, because I guess as someone who served in and worked in mental health for over 20, 25 years, we've seen record investment in this space. We've certainly seen record attention into mental health, but the research over that period suggests that things aren't getting better for young people. Young people's experiences are not necessarily going in the direction that would match that investment. Why do you think that we've seen these mental health concerns rise over this period? And I think for everyone in the audience may think that this is a pandemic related thing, but obviously this research, most of this research is happening pre-pandemic. And so it's not really about COVID-19 at all. It's about something much more broader in society.
Thanks, Gunn. Actually, I've answered that question quite a lot in the last couple of days. We've had some great media interest in this report. And I really reflected on the sort of stresses and pressures that young people are able to have experienced over that period of time, and how different life is now in 2020 compared to 2012. There is an extraordinary amount of information available to all of us through an extraordinary amount of channels, most of which are unfiltered, most of which are unmediated. And you know, the days of, if you had to, you know, if you were sent to your room by a parent, you basically you could listen to the radio or read a book or stare out of the window or, you know, be on your own. Now, actually going into that space, your access to the world through the internet essentially is infinite. And the stimuli and the information that you can be receiving in a completely unfiltered way is is overwhelming. And I think that for me has been a huge shift for young people over the past few years. The information they receive that's unfiltered. Yes, there's fantastic information available on the internet and on apps about how to support yourself when you have mental illness or mental psychological distress. But I also know from my experience and the experience of my children, there is a lot of very toxic information there as well, which is unfiltered and unregulated and just as easy to access as, if you like, the good stuff. You know, as adults, we make shopping decisions. Sometimes we make bad shopping decisions. We get scammed. We give our credit card to some dodgy thing. But we use our kind of our intuition and our filters to go, well, I think I'll probably buy something from that retail outlet. I heard of them. They've got a good reputation. Might not buy one from them. Never heard of them. My browser thing is coming up telling me that's an unsecure connection. We're using that kind of intuitive response, which we've developed as adults. Young people don't have that fully developed. And this is one of the areas that we should be able to focus on instead of saying, well, let's just say, well, you know, young people haven't got it developed. What can we do about it? That's exactly what we need to be doing about it. It's helping young people develop their own protective strategies about how they make good discerning choices about the information that they're receiving. And for all of us, you know, I think, and you're absolutely right to reflect that this is not just COVID showing up, but I think for all of us in the last few months, we can identify what it feels like if all you hear about is one thing, and all we've been hearing about, well, apart from Trump, all we've been hearing about was COVID in the past few months. Every single news channel, everything that you open, everything that you look at, and you're then sensitized to that, and everything sounds like it's a message about that. And I think it's the same with young people facing psychological distress. If they're sensitized to something, every stimuli feels like it's about that topic, and we're not doing enough to filter it. So there are some thoughts.
Yeah, thank you for those reflections. And maybe as I pass over to you, Jennie, I might build on that and also bring in a question that's already come through our Q&A from Fiona. It really builds on this idea, I think, that James is talking about around social media, the correlation that's there into distress, particularly perhaps in young women. Is that one of those factors that you think is driving this right? Is there enough evidence where we can kind of point to what are the changes that we need to make, or is there something much broader going on and kind of, you know, social media is the devil of our time?
Yeah, there's a lot of complex issues at play, and as James said, there has been a lot of changes in our society in terms of how young people interact with the world. But you know, when we know, particularly from this report, that we saw this increase in psychological distress for those people who had kind of extreme screen time use. But that is, we think that's mostly correlational, that, you know, young people who do have psychological distress, extreme levels, kind of withdraw, and they're more likely to spend more time on social media. And we haven't been able to get at the moment. It may come, but at the moment the evidence is not convincing in terms of that leading to increases in psychological distress. But there may be some other things at play, like you know, when you're using your screen more, you're less likely perhaps to have, you'll have less sleep. Perhaps if you're using your screens into the evening, it's going to impact on your sleep because of just the light that you're seeing from your screen, but also just that activity that you might have. And so we know the critical role that sleep has in causing mental health problems, and also vice versa. Once you have mental health problems, that affects your sleep. And we saw that really clearly in this report, that young people with psychological distress had really poor levels of sleep. 6 hours is not enough for young people and their developing brains to be able to you know, function. And that is, you know, we know the effects of sleep when you are sleep deprived, that affects your levels of irritability and psychological distress. We also know that screens perhaps might lead to less physical activity, and particularly with COVID at the moment, we're not able to get out as much. That also has an impact. But there's other societal changes, I think, as well. We're much less connected to organisations and social groups than what we have in the past, particularly for young people. So I think there's a lot of factors at play that we really need to get some good understanding, particularly in Australia, about what the factors are.
Thanks, Jennie. And I think, you know, that's really important of I guess we're all complex beings, right? That young people have complex lives, that there may be, as you said, a much a much more complex interplay in technology, young people, how they live their lives. I think, certainly when I look at my boys, my oldest boy is just entered his teenage years, missed out on pretty much the whole of year 7 this year, a critical time. And I often talk to him that technology is a great link to his friends, but also a great way to distract from just being really, really present and having to learn those skills. And I guess I really want to build on then, Jennie, the report has a series of very, very solid recommendations. Again, we've seen if I was a government member here, I would say, look, we're putting record investment. I think that would be what they always say, record investment into mental health. We're backing organisations like Black Dog at record levels. Are these recommendations being picked up? What are the kind of the critical recommendations for governments to do? Is it about doing more rather than doing things differently? I'm sure we've got many young people and parents on this line as well. As a parents of teenagers, I look at that data and go, what do I need to do differently?
Yeah.
So can you help navigate that through and say what is it that we need to be doing in a systemic level, perhaps looking at kind of government and broader investment, and is it more or different? And at a personal level, what should parents be taking away from this to say that they can do to better support their kids?
Yeah, I mean, I think there has been more investment in mental health, particularly in youth mental health, which is great, but it's not enough. What we need, I think, is more whole of government reform to youth mental health. This means coordinating schools and health. At the moment, there's not connection between those two governments that we really need to coordinate together and collaborate to be able to deliver a better solution for young people. We have universal interventions that can be delivered at schools that we know are effective in actually having an impact on preventing anxiety and depression, but they're not currently being delivered. So that is, I think, one step that we need to do is implementing these universal interventions in schools. And also screening, and James mentioned this earlier, we really need screening in schools and prioritising mental health in the same way that we do education outcomes to help track mental health. But screening on its own is not really sufficient at the moment because, there are a lot of roadblocks in mental health services at the moment, and we really need to be able to increase the evidence-based services also, as James said, provided to young people. Currently, there's this massive roadblock. If you are a parent and have tried to get mental health care for your young person recently, you would have been struck with the ridiculously long waiting lists that there are, that many clinical psychologists have either cut off their waiting lists or you've got to wait 6 to 9 months, which is just, it's just not, it's not providing the support that we need for our young people. So, we think schools are kind of a near universal touch point for young people, that this is a really critical place that we can provide investment and support for young people. And at the moment, the number of school counsellors available per student, particularly in public schools, is not sufficient, and there's a major discrepancy between private and public schools. And no regulation about which programs are introduced in schools. Like, the programs don't have to meet any standards prior to being delivered. So, we think is part of the recommendations of this report of trying to make sure that the programs have some sort of regulation about and some sort of standard of evidence that has to be required before they get delivered. And at the moment, principals can make a choice about what program that they think works, and it's not based on whether or not the program works, which I think is really important. So at the Black Dog Institute, we're actually looking at developing and evaluating digital tools with a particular focus on this idea of a blended care model, because the waiting lists are so long for clinical psychologists in the community. How can we help support that waiting list period, and what digital interventions can we provide that might have an impact and kind of support through that process as well? So capitalising on those digital programs as well. So lots of things I think that can be done at the government level. For parents, I think, I have 2 high school students as well in my household, and it is a real struggle. And I'm an expert in youth mental health. And I should know how to support young people, but it is really hard, particularly at the moment, being able to provide support. So, we need to make sure that our young people are eating regularly and exercising regularly and just getting on top of that sleep. I think it's so easy, particularly during lockdown, to let that run, but making sure our young people are going to bed at a reasonable time and getting up You know, particularly with lockdown at the moment, we've got this flexibility for young people to fit better into their usual sleep habits, which are to sleep in, which is really great. I think that's a great thing for young people, but just making sure that they're getting sufficient sleep. But a lot of other things around helping them to reach out and get support if they do need it, and still trying to find ways to connect, using social media to connect with their friends, whatever platform they use. I think that's really important. There has been this kind of, we're quick to blame social media, but yet at the moment, particularly for young people, this is the only way that they can connect with their friends. So, but having some choice around the best way to do that and make sure that they're connecting with others, I think is really critical. And just creating space to actually listen to your young person as well, making sure you've got time to connect with them and find out what's going on for them.
Thank you for I guess certainly the big picture, but also for, as I said, for the parents out there who may be listening. And the comfort that I take away from that is actually a lot of the things that we knew to be true, or our grandparents knew to be true about good parenting. Stay connected to your friends, eat vegetables, get your sleep, get out and exercise, haven't gone away. And I think that, you know, again, I want to really make that call out for people on the line of sometimes we can get overwhelmed thinking we need to do something new, where in fact executing the basics probably does more. And I want to bring you into this conversation, Nathan. Jennie has spoken a lot about what could work better in schools, schools being an obvious intervention point, although schools may look different on the other side of the pandemic perhaps than they did as this report was, or the data for this report was being developed. What would have helped you through those final years of school, or on the other side of school? What are some of the things that you as a young person want to see happen to better support yourself and your friends?
Yeah, thank you. And Jennie, those were some great points. I think it's really important that we start normalizing the conversation around mental health, because the pandemic has brought along, you know, all these ideas of how mental health is so important and we need to start talking about it more. But prior to COVID, that wasn't really a thing, and there was a lot of stigma about it. And I'd find that, you know, people would go to sick bay for some sort of injury at school. But when someone was experiencing mental health issues, it just wasn't talked about. It was swept under the rug and we couldn't chat about it. But I think it's important to have a really good focus together as a class, or, you know, group of friends, about talking about your mental health and prioritizing that. And I think some of the recommendations from the report have been really great, including sort of an overhaul of mental health in schools and using the school as a touch point for us to connect with the mental health sector, and actually having some regulation around, you know, the services that are implemented in schools and evaluating those, and making sure they're relevant and accessible to everyone.
Thank you. And again, I just keep being struck by the reasonableness of all this, right? I think there was a great comment that came through question and answer. Again, I encourage people to include of even with that record investment, if you try and get access to a psychologist at the moment, you're probably looking at a number of months waiting list. Certainly, I know many friends who've been seeking and asking my support are getting kind of told that unless the situation is absolutely dire, then there's just simply no room on the books. So I think it does mean we've got definitely a capacity constraint. And again, picking up your point, Jennie, we can't simply just build in the same models. We've got to look at those blended models. What can we do to build in scale into that system? And I think in that sense, we're grateful, Stephen, and maybe I'll ask you to put kind of your two hats on. You run one of the most and involved in one of the most important technology companies in history. Certainly you're a large employer here in Australia and an influential organisation globally. Probably the obvious question is, you know, why for yourself in setting up the Corporate Mental Health Alliance, why Microsoft, why pick this issue in terms of mental health? What's driving it for you, and what's the role that corporates and businesses can play in supporting Nathan's generation start turning this around?
You bet. And Jono, thank you so much. And let me just say from the outset, it's just a great pleasure to be here. And thank you, James, for the invitation to join. We were planning to do this in person, and we are looking forward to getting back in person sometime soon. But I have a couple of cockatoos who, Jono, is sitting outside my study here. And if you hear some noises as we go, just let me know. We'll have to let them pass. But I'm actually in Camaragal. I should say in Cameray. I want to acknowledge the Camaragal people as well, the traditional owners of this wonderful place that I have the privilege of living and working on. But look, to your question, Jono, and I think it's such a credit to Mission and to Black Dog, the creation of this report. And in fact, the 20 years that Mission have been working on their youth survey report is of fundamental interest to employers. And so I'm going to offer that employer perspective. But as I make these comments, I don't think I'm making them. In fact, I know I'm not making them on behalf of my business. I'm making them on behalf of many businesses. We are deeply interested in what the future of our country think of the world around them. And this youth survey over 20 years has prepared us so well, I think, and given us such a rich corpus of information that we can reason over and we can use to help us think about, as employers, what are we doing in regards to the workplaces that we create. I think fundamentally the starting point is that work can be and should be a source of positive mental health. Having a great job is something that is at the heart of many people's view of having a positive disposition about the world around them. And so this report and the youth surveys over the last several years have highlighted just how significant the concerns are around mental health. It's supported by reports that we run ourselves inside our business and across our clients. Just one recently that we ran with 30,000 respondents around the world highlighted that, in fact, as we looked at the generational report, or the generational aspects of the report, Gen Z, who are obviously youth as they've just started in the workforce, those that were born, let's say, from 95 onwards, about 60% of Gen Z in our report suggested that they were struggling or just flat out trying to survive through this period. Much higher proportions in relation to reporting poor mental health than other generational groups inside our workforce, and in fact inside our clients' workforce. So it's a vital interest, Jono, I think, to your question, this topic. It's why we've come together with other employers here in Australia to create the Corporate Mental Health Alliance of Australia. And for me, it is perhaps points to a better outcome or a more positive future, because this report and the concerns can be overwhelming. I think that point was made earlier. And we can often feel as though the money that's being invested by government, the work that's being done isn't achieving all that it needs to. And I think that's fair to say. But I do think these reports and these indicators are helping us in the workforce to think more deeply about psychological safety and how we have to play a really important role in ensuring that as people come into the workforce, that we address the concerns that Gen Z and others are reporting. And so the Alliance is doing a lot of work. We can talk about some of that work later if the conversation goes there. But I guess I just point to the fact that, for parents listening to this or for those worried about the future, there's a lot of work to be done, no question. But employers are getting it. We've got a long way to go. And I'd say we're at the very first stages, if you will, of improving psychological safety in all its aspects across workforces. But there's a really strong conversation being had, and it's informed by the reports like the one that we're releasing today.
Thanks, Stephen. I actually want to also build up another point, maybe stay with you for a second around technology, digital. We've heard in this conversation, it's a very kind of complex relationship that we have as a community. Young people, is it harming? Is it benefiting? Is it the answer? Is it the problem? I guess as someone who's leading a technology company, particularly through this pandemic, where I know, again, for me as a parent, anyone saying to you, try and reduce your kid's screen time while your school's saying, here's 6 hours of work on a screen, is somewhat kind of challenging as a parent, right? Do we know enough? I guess the question, companies like yours that have that demand to roll out changes to technology incredibly quickly, how do we get that work that I think the E-Safety Commission has been talking about, safety by design, so that we're seeing some of these or managing some of the perhaps unintended consequences of big, large-scale rollouts, embedding them in the community, and what role do you kind of see in technology companies playing in that? Because it's clear that it's here, it's vital, it's going to be the way in which we navigate the future. But what we're also hearing is that it does bring with its challenges, perhaps that weren't intended.
Totally. And this relates to one of the questions that's in the Q&A thread, and Jennie touched on this earlier. Social media is a tool. At the end of the day, it's a wonderful tool. But of course, like any tool, it can be used to do things that are positive, or it can do things that are negative. It's all in the use of the tool, or the overuse in some cases. And so I think the starting point here, Jono, for that question is that technology, social media, but then technology more broadly, has a really important role to play. But we need to be thoughtful about how we use that technology and how we use platforms in this context. The report I mentioned a moment ago, the one that we've run across 30,000 people around the world, asking them about their work experience. And this report we commissioned last year, just after the pandemic had started. Not surprisingly, stress, anxiety, mental health concerns came very clearly to the surface. And I mentioned the disproportionate reporting of that for our Gen Z cohort. But as a result of that report, that has informed and is informing how we, in our business, and it's, again, not just at Microsoft, there are many technology businesses and many businesses, full stop, that are thinking deeply about how they evolve to respond to these challenging circumstances we find. And the realization that as we come out of the pandemic, the life that we are living increasingly engaging in this way, and kids going to school on for 6 hours a day, as you mentioned, and telehealth, and the many, many other ways people engage with life through a digital lens, that's likely to continue in many regards, because there are lots of benefits that come from it. And so we're thinking deeply about how do we improve the experience, the digital experience that anyone might have. And in our case, that might include, as we are, collaborating with Headspace. And this is just one example, but we're building in linkages with Headspace, which is a meditation app that you might use at any point during the day, or you might be prompted to use during the day to create space between what might otherwise be a set of meetings. We're creating other capabilities around digital commutes, right? The commute, going to work and going home from work, used to be a natural break for many of us. That doesn't exist anymore when you're rolling out of the shower and walking into your bedroom or your study to join a call, right? And so we're creating that into digital platforms so that there's a prompt for you to actually physically take a break, whether that's to read something, whether that's to listen to some music, to perhaps use Headspace or whatever other distraction you'd like to engage in. And so building those into our platform is part and parcel of what we're thinking about. There are many organizations working on similar ideas, and I think that's a natural reaction to this time, that is, life has changed. We know that for sure as a result of the pandemic, and tools and technologies are going to evolve to support us. What's essential though, Jono, and perhaps the last thought, is that we have to be conscious of those changes. And as parents, as leaders, as anyone who's interested in supporting themselves or their family or their community, we just need to be thoughtful about how we're using the technology and tools that we have around us, so that we don't create or don't see those unintended consequences that can often be on the negative side of the ledger.
Thank you. And maybe, James, if I bring you back into the conversation here of as I said, one of Australia's most significant organisations, the focus of much of your work is how do we better support communities and individuals who may be left at the margins of some of the challenges and benefits. It struck me as we went through this report is, again, the same risk groups. I did one of the first studies in Australia in 1998, looking at the relationship between sexual orientation, suicidal behaviour in young people. We're again seeing, the same groups at risk, and yet we're not seeming to give them the services. I think one of the recommendations is how do we do gender-based services better? What can we be doing better in terms of designing services to better engage and support those who we already know are vulnerable? It's not going to be revealing research, I think, in this context to say that young Indigenous people are vulnerable, that LGBTQI young people are vulnerable. So how can we find better solutions with them? What's your sense of that from Mission Australia?
Yeah, thanks, John. A couple of thoughts. And the first is, don't ask me. I'm an old white guy, and it really, to the point that we made in one of the research recommendations is, you should be, should be asking Nathan. And Nathan is, and you know, that's not to put pressure on Nathan and say, you represent every diverse youth community in Australia, Nathan, give us all the answers. It's a point of saying, you know, engaging with people at the point of, if you like, at the point of their diversity, and saying, what does a service which would appeal to you look like? When you walk up to a service or when you engage with the service on the internet, does it look like you have allies in that service? And are you then going to go click into it? Or does it look like a service that isn't really there for you? What are the signals? What are the messages that you're getting through the shop window, whether that's a physical shop window or a virtual shop window that's telling you that you want to engage with this service? And I think, so that's that's for me is the important thing. And actually, asking people of Nathan's age and generation, what would have worked for you? Because there's a reflective opportunity for young people. Because if you, I know from my experience, Jennie, happily, I haven't got, they're not at high school anymore, they've left. But I know your pain. If I asked them when they were 15, what does a service look like for you? I'm not sure I'd have got much traction out of them. But if I asked them at 20, what would something at 15 have looked like for you? There's a gap, there's a sort of reflective gap to say, that would have been really helpful. And that thing that I didn't want to do, well, I probably really did want to do it, but I was just being a pain in the neck. But I think it's about actually getting closer to the diverse cohort that we're trying to reach and engaging them absolutely clearly in the design and development of services. The piece around, yes, lots of money's been spent on services, and that's absolutely right. But has it been directed clearly at these groups which we've identified in the research? So young women, Aboriginal and Torres Strait Islander people, non-binary people, LGBTQI, and young people with disability. Has servicing been adequately directed towards engaging them, or has it just been poured into more mainstream offerings and going, oh, it's great, we've built more mainstream offerings, and actually what we've identified is a whole segment of people that are being missed up. And just the final point, one thing in common that nearly all of those young people have is they go to school, and they will go to school. And to Jennie's point, a screening opportunity at an earliest possible time to identify people who are showing the telltale signs of likely psychological distress or things would make such a difference in terms of earlier intervention and prevention activity, which is so much more effective and is evidentially so much more effective than waiting for crisis to happen and waiting for someone to turn up in A&E having attempted suicide or self-harmed, actually when something could have been done over here, which would have meant that would never have happened. So shifting the emphasis of investment into earlier assessments and earlier prevention and intervention, and don't ask old white blokes about how to design services for young, diverse Australians. Yes, so
I might then pick up on that challenge then, Nathan. You for good or ill, in this panel are the voice of your generation, and you certainly have the best background of anyone on this panel. What can we do better to take up James' kind of challenge? Old white dudes still hold the purse strings, right? Let's be clear. People in power still control cash. They still control what will happen. And I think, what I'm hearing from James is, and certainly I imagine, Stephen, you would say this in all the work that you've done in co-designing technology services to better embed take-up, right? What can they be doing differently or better to engage you in that design to get solutions that are effective? What would that look like? What would have had that look like for you?
Yeah, well, it's a great question. And I think all along the way, for a service like Headspace, there are different barriers for different people. I think for me, I was lucky that I could see people like myself that were being represented in those services. So that was a good thing. But then, once you start that process, there's long wait times, and that's a barrier in itself. Right now, Headspace has wait times of 8 or so weeks. I'm currently waiting to see a psychologist, and it's a 3-month wait for my first appointment. So that's a barrier as well. But I think the idea of screening young people from whatever age it is, whether it's, year 7 at the start of high school, it's a great tool for both the school and the young person to feel like they're being connected with each other, and to really start those conversations around mental health. Yeah, I think it's really important to paint a bigger picture from the start and really start having those conversations at an early age, as opposed to waiting for young people to get into, year 9, year 10, when school's getting a bit harder and challenges are growing and employment is an issue as well, relationships and all kinds of things. So I think if we can start with that preventative sort of process from the beginning, then we'll start to see young people hopefully feeling a little bit better about life and feeling like they've got a connection and a place they can go to deal with those issues. And I think school is a really great touch point to start that whole process.
Jennie, we've heard a lot about screening. I think that may be then, I imagine for people online, that's, what does that mean? I know when I was working throughout Southeast Asia in communities that were ravaged by HIV/AIDS, there was a very genuine debate that went on, which is if you screen people and there aren't the services on the other side, are you being more cruel? We're already hearing about elongated waiting lists. We're already hearing about the system at stretched capacity. My kids in year 7 screened. What does that look like? What is the information that Nathan would get back? What is the information that it needs a parent gets back? What does that look like? Can you paint that picture of what that solution would look like?
Yeah, it's a really good question and issue that you've raised, because the screening, it is really important that we have that, but we can't do that without having the services there to, as you said, if a child is identified, and then it just places them at greater risk, because then there's there's no hope if I have to wait 3 months, 8 months to get help. So we need to, I think the screening should be more of a stretch goal, that we need to work on the services first and providing that support, and then have the screening that can feed into that. So by screening, it would be, whether it's a similar way that NAPLAN is delivered, or that, all young people have to fill out measures that we've got that can tell us, okay, is this distress more, in the same way that we've done in this Mission Australia report, is this above what we would expect for this young person, and what are the possible options then? And we know that there are some really good digital interventions that have low intensity and low, you don't have to necessarily see a psychologist, or we can use what we talked about before around that blended care that they can have while they're on that waiting list to see somebody face to face. And so getting those platforms set up, and that's what we're co-designing at the moment, or wanting to at Black Dog, is actually setting that up so that young people do have those services while they're waiting. So, but I think it's really important that we get those services in place before we start doing the screening, but that it is a really critical part of the picture.
And Stephen, is this a place where we can bring in technology companies like yours? I mean, the one thing that you do well is scale and speed. You solve problems and address issues at a scale and speed that few companies in history could even imagine, let alone deliver. There's a really big challenge. I think you brought this up with Headspace app being integrated into solutions. Has the resilience movement failed over the last 15 years? I know it's a big question in terms of prevention and engagement in corporates. From someone who's leading and engaging in organisations, can we do more in that prevention, building resilience in this generation space, and what can we do to solve this problem of services at scale?
You bet. Look, I did 2 thoughts, Jono. Nathan made a really important point earlier about the normalisation of this conversation, and as simple as that concept is, I just want to reinforce how vital I think that point that Nathan has made in context of your question, because it's reports like this and it's this conversation that are helping to inform the change that is occurring. Is it happening fast enough? No. Does government need to do more? Of course. Does business need to do more? Yes. Do we all need to do more? No question. But I just think about how far we've come, right? Oftentimes it's difficult when you're in the moment. You just can't sort of appreciate the progress that has been made. And I hesitate, because I know that doesn't help someone who's looking for support right now. I understand that. But I am hopeful, because I have seen a dramatic change and shift in how this conversation is being held in the workforce, in the workplace. And I mentioned the Alliance earlier about the number of organisations now coming together to think deeply about this topic and just ensure that we play a role, not at the superficial level, but that we look at the real creators of stress in the workplace that relate to job content, culture, and quite frankly, leaders, right? Leaders inside organizations having an awareness and an appreciation of this topic so that we can have an open conversation about what it's like, what the pressures are like, and how we work together to best alleviate those. Second thought, then coming directly to your question, I think that's the crucial element that then informs organizations like Microsoft as to how we might use the scale and the scope that you've talked about. To be fair, technology, as I've said, is just a tool, and there are many, many, many apps out there that I think operate at the superficial level, well-intended, but there are many things out there that I don't think are making any substantive impact in the lives of either our youth or indeed anyone else across the workforce who might be using those services. I'm not criticizing them, I'm just observing. That's one of the learnings that we've had very early on, working with Black Dog ourselves in the Alliance and others who are leading in this space, to say there's the cake associated with psychological safety in the workplace. And a lot of the work that unfortunately to this point tends to be on the icing, whether it's yoga or fruit bowls or some of the other services that you might see in organizations and workplaces today that don't really go to the heart of this issue. And it's certainly not at the heart of the issue that the youth are reporting in this report. So I think the bottom line is, yes, we have a role to play, the tech industry for sure, because we can and will create the tools that will help us deal with this in future. But it's the conversation and it's the understanding and it's the dialogue that we're having here that informs government, that informs business leaders, helps us to learn so that we can improve. I think that's the real value that we need to continue to explore.
Thank you. And thank you, everybody, for those wonderful thoughts. We've ranged far and wide: service design, better engaging corporate leaders, screening in schools. There's a lot, I think, in this report triggers. And once again, our thanks to the work that Mission Australia has done in really engaging young people over many years. Obviously, your collaboration with Black Dog in interpreting part of that data. I know there's a lot more in the research that you do, James and team, and thank you in particular for the insights from bookending this in the work that Nathan and Stephen does. We have one kind of final question, and then I wanted to kind of hand over to you, James, and wrap up. And Jenny, I know I won't do it justice by asking this, but there's been a focus in there on kind of gender-based spaces. I guess that can be perceived as fraught or biasing one group over other or disadvantage. In making that recommendation, what do you see as the challenge there? And is it a need that we do need to create greater investments based around risk, and there's a risk that you've highlighted here in young women in distress?
Yeah, I mean, what we did see in this report was that 1 in 3 young women have psychological distress, which is higher than young men. And it is really troubling. We've seen these increases in anxiety and depression in all young people, but particularly for women, we've seen this a greater increase. So they're at greater risk. And actually, this is consistent across all groups or vulnerable groups actually that don't have equity in our society. So young women, Indigenous people who identify as being non-binary gender, LGBTQI, people with disabilities. So it's kind of, that inequity that occurs in our society. We are also seeing higher levels of psychological distress. But thinking specifically about women, I just wanted to raise some points that, still young women are at greatest risk of being victims of violence compared to any other time in a person's life and any other gender. This young 15 to 24 in particular, you're more likely to experience violence in this time in your life if you're a young girl. So I think that is a critical issue that we still need to address if we're wanting to address mental health problems in young women. Young women have more to be distressed about, more unfair treatment, less opportunities. So I think that is a critical issue that we do need to address. And then just also making sure that we invest. A lot of our research actually comes from, particularly our animal model research, all was done on male rats, to be to be frank, which is really interesting. You know, we have women are much more complicated. They have a lot more complicated hormones to be able to track. And, you know, so a lot of our knowledge of psychological distress and mental health comes from male studies of male rats, male animals. So I think we need to invest more in our understanding of women's mental health. And so I think that's a critical recommendation of this report.
Thank you, Jennie. And I think even just picking up that final point, you could probably have another hour exploring kind of bias and various issues that emerge. Just in handing back to you, James, thank you very much to our panel. I hope people realise that what I've tried to do in the Q&A is pick up the themes around the questions that have come through there and weave them in terms of service provision, in terms of groups that might be marginalised, challenges that we have around resilience. I'm sure the team at Mission Australia would be happy to engage with anyone who's more interested in this report, as I'm sure Black Dog and Jennie and the team would as well. Probably one final thought from me, which really goes back to that kind of question around hopefulness. We have seen more advances in basic science probably in the last 12 months than we have at any other time in human history, and it took will. You know, if we can, my general view is if we can invent and distribute a vaccine for the first time from a start and do it now where we're rolling it out in the hundreds of millions safely to the community, then even though this is a big challenge, it doesn't strike me as a bigger challenge. It's just a challenge that may require that sort of will and focus. So I think what you have here is people who are incredibly passionate and willing to put their shoulder to the wheel. And I think it's a challenge to all of us as a community to say, are we giving this enough priority? Because if we can invent a vaccine and distribute it to the globe inside 12 months, then surely we can address some particular crunchy issues that seem entirely reasonable, like school screening, better services, shorter wait times, and all those things. So thank you very much on my behalf. I'd love to just hand over to James to wrap up. And Stephen, I think we take up your challenge that at some point we would all love to have some of these things in face-to-face. And thank you again for the support you give to the whole of the mental health sector. Over to you, James.
Thanks, Jono. I'll try and squeeze us all in. Thanks to Nathan and to Jennie and Stephen for joining us on the panel. I really appreciated your insights and thoughts this morning. I guess, you know, today's Are You OK Day, and it's worthwhile reflecting on the significance of that and way in which that has brought some of the conversation about mental health into the public sphere a lot more. One of the questions in the chat was, you know, what would you do effectively if you were redesigning the system? What would it look like? Well, it would be so normalized to have a conversation about well-being and psychological safety that it wouldn't be a thing. That would be really where I would want to get to. And if we think about the time that we have now and actually not wanting to take away from this on Are You OK Day, no, I don't want people to go away despondent because of the situation that we have fleshed out through our research, and thanks again to the teams at Black Dog and Mission Australia for the work here, is to imagine that if we look back in 10 years' time or 5 years' time and said, you know what, in 2021 we had a moment and we missed it, and now it's all over us, and we could see it coming and we didn't do enough about it, and now it's all over us, and now it's 1 in 2 young people experiencing psychological distress. And those people that were in that cohort that were in that survey are now all in the workplace. And now you've got all sorts of issues happening in the workplace because of people moving into work with untended psychological distress. That, I think, needs to be the stimulus to say, we have got a moment now to do something. We don't just need to say, well, this is all over us, we can't do anything about it. Yes, we can. But a very big part of that is just lifting up the conversation and saying, it's okay. It's okay to be not okay. And it's okay to talk about it. And it's okay to talk about it at work. And it's okay to talk about it at home. And sometimes we need, you know, professional help and guided help and assistance from people who are, you know, skilled helpers and experts. And that's okay too. But that needs to be there when we need it. But also, we also need to be able to opening ourselves up to the thought that we can all have these conversations and all help each other and steer people in the right direction. So thank you so much, Jono. Thank you for the rest of the panel. Thank you everybody who's joined us this morning. This could have gone on a lot longer and a very rich topic. And thanks again to Black Dog and to Microsoft.
Thank you all.